only 10% get the diagnosis of dementia. So 90% are out there who don't get a diagnosis, who have no access to diagnosis, or perhaps don't even know what dementia is. Families don't come to us when the condition is mild. So that's the biggest problem we have. If they would have come when the situation is mild, they do not have to suffer. I'm not even talking about the patient, I'm talking about them. They did not have to suffer so much, because when you come in milder stages, you're prepared for what is going to come. There are ways we can keep the person with a better quality of life for much longer. There are also dearth of healthcare professionals who can actually assist when it comes to dementia care, right? Or perhaps a little in the western part of the country as well. But the other areas, it's a huge challenge. The services are highly few and fragmented.
And let's face it, Ramani, we are sitting in a country which has made digital payments so easy, so accessible, and so affordable as well. And I'm sure that somebody somewhere will come up with a solution to make care.
And as I was talking to you, I think a national dementia policy will soon be a reality in India. I'm very, very hopeful that that will happen. With Niti Aayog working on the brain health blueprint for the country, I really feel that maybe in a couple of years, India will also have a national dementia plan.
88 lakh persons are living with dementia in India. As India grows older, those numbers could double by 2036. And all of us are at risk for dementia just because we will grow older, and just because India is the diabetes capital of the world, and diabetes is a key risk factor for dementia. And what's worse, there is no cure. Dementia care is expensive. It involves specialized personal care that can drain you emotionally and financially. What does it entail? What facilities are available in India? How much does it cost? These are some of the questions that we will seek answers to in this episode of Longevity Short. Joining me is Ramani Sundaram. Now, you've met Ramani before. She's a neuroscientist and an MBA by training who has spent over 15 years in dementia care with the Nightingale's Medical Trust. She's also the driving force behind the Dementia India Alliance, what is probably the first pan-Indian organization to address dementia, diagnosis, treatment, care, and policy action. Earlier, we spoke to Ramani about dementia, its different stages, how you can prevent or delay it. Now, make sure you tune into that conversation. The link is on your screen, because most of us Indians over 40 are at risk for dementia. There is also a downloadable PDF available of the risk factors. The link to that also is in the description below. In today's conversation, Ramani will tell us more about the landscape of dementia in India, the severity of the problem, and the care facilities that are available for individuals and families living with dementia. Ramani, thank you very much for joining us again. And, let's talk a little bit about the landscape of dementia care in India and how severe a problem that is. And of course, what is the biggest problem when it comes to caring for people with dementia?
Right. So I think there were multiple questions, so I'll answer one by one. See, with respect to the landscape, how does it look right now? See, the reference study that we have is the LACI-DAT study, which happened in 2019-2020. It says that there are 88 lakh people with dementia in India, and they say that this number is going to nearly go double by 2036, with about 1.7 crore people with dementia at that point of time. And they have also said the prevalence is somewhere between 7.4% in people above the age of 60. That's what the study says. But one thing we have to understand is all this is given that only 10% get the diagnosis of dementia. So 90% are out there who don't get a diagnosis, who have no access to diagnosis, or perhaps don't even know what dementia is. So the numbers that we know of may really be just the tip of the iceberg. We may not know a lot of numbers of people with dementia who are suffering, and perhaps we've not really reached out to them, or perhaps they themselves don't know that they have dementia. That's how it is. The landscape, that's how it looks. There's also lack of insight. People don't think they have a problem. Even if the children want to take them to a clinic or something, they really don't want to come. So that is there. It is more in the urban scenario. In rural scenario, the situation is even more worse. People don't really have access to basic healthcare. Here we are talking about something that is pertaining to brain health, something that is pertaining to the more vulnerable population, such as elderly. So there is definitely a huge challenge there. There are also dearth of healthcare professionals who can actually assist when it comes to dementia care, right? You talk about neurologists. I think the last data we have is about 6,000 people we have in India, neurologists, 6,000 of them. There's n number of neurological condition that they have to address. We're talking about psychiatrists. I think the number is close to 9,000. Look at the numbers for people who are in billions when we're talking about access to care. So there is a problem there. And with respect to services also, right? When someone gets dementia, where to go? Sadly, what has happened is, we also run a national dementia helpline. Is, people can call, they can seek guidance, they can ask us for referrals. Those are things that they can do by calling this helpline. Um, when people call, thankfully, South is somehow better placed in being able to provide some sort of services to dementia. People at least know that there is a condition. There are medical institutions who look into dementia, and there are care providers who provide care for dementia. There are psychologists, social workers who understand dementia. So there is help that is available in South, or perhaps a little in the western part of the country as well. But the other areas, it's a huge challenge. The services are highly few and fragmented. So we are unable to actually refer people. People have to really run pillar to post, even to get a diagnosis, just to understand what it is. And what also happens is, see, a diagnosis of dementia is a life altering diagnosis. You can't give it away in a diagnostic setting, say, oh, you know what, your mother has dementia. She's going to forget. She's going to perhaps forget everything. I'm going to write you certain medications. So just get prepared for it. That's not how it works. You have to really sit the family down and tell them what is going to come to them. Because your next question, you asked about the cost that is associated with dementia. There's so much planning that the family needs to do. I wish that family knew all that before they got into the stage where they come and ask us for help. For example, somebody would come and tell, I'm spending for my father for his care, but I'm not able to withdraw his pension because he's not able to sign anymore. He's not really worked out a will wherein, or he has not given a power of attorney, or I am not the nominated representative. What do you do with the money that is coming to that gentleman which cannot be used for his care? So there are challenges like that. People really don't know what to do about that. So there are issues like that that needs to be discussed. Or there are multiple children who are involved. The person, when he gets dementia, a son may want it to be done a certain way, or daughter may want it in another way. But what about the wishes of the person who has dementia? What would have he wanted? Nobody knows, because in India, these are things we don't discuss. We don't discuss death. We don't discuss dying. We don't discuss end of life care. We don't discuss what happens when I'm no longer able to decide for myself. These are conversations we avoid. And dementia has taught us these are important conversations you need to have. It's important that we have those conversations. And with respect to cost of dementia care, again, we do not have reference figures. The last study which spoke about the cost of dementia care came out in 2013, which said that the cost of dementia care in an urban situation may somewhere range between 9 to 12,000 per month. And rural, we don't even know. We don't even
9
know.
to 12, again, 9 to 12,000, I am assuming is the cost that you would spend, or that the money that you would spend on care, right?
Right.
If you
Absolutely.
are
And
getting
since
help or something like that. But
2013.
and
You
that
see,
it would not cover medication or
absolutely.
associated problems.
No, see, medication, care, everything inclusive, in a very, very conservative estimate, it calculated. See, you also have to understand, how do you calculate the cost to dementia care? It's something challenging. I'll tell you why, okay? Because, say, I am looking after somebody with dementia. I am. I look after my father-in-law with dementia. So if I leave my job, sit at home, and look after my father-in-law with dementia, who accounts for that cost? It's a loss of income. It's an informal caregiver cost. So it's an informal cost which never comes into costing at all. Because above all that, I may spend on medication, I may spend on diaper, I may go to a doctor, he may have a fall, I may work on hospitalization, I may engage a home help, I may engage a caregiver if required. All these costs you can account for. What about the cost about my loss of income? See, that is something that we never account for because caregiving was never seen as a job. It's a duty. You do it. And if you're a woman, even more so, it's your duty. You just do it. You have no rights to say whether you want to do it, you don't want to do it. So, this is very, very challenging to calculate when it comes to dementia care. But there are some estimates available. And according to the recent estimate, if you have to care for somebody with dementia in an urban scenario, it may cost you anywhere between 2.5 to 3 lakh a year. Because if you actually just take simple things like diaper, when someone goes into the moderate stages of dementia, they would need diaper, right? An adult diaper, the cheapest one would cost you 30 rupees per piece. An adult may need 4 to 5 diaper a day. So we're talking about 150 rupees per diaper per day into 30 days we're talking about, right? So that itself is going to give you like 4,000 to 5,000 rupees per diaper. Above that, there is medication. Above that, you cannot leave the person alone. You may have engaged either a house help or a home care provider. You can work out the cost yourself. Even the 2.5 to 3 lakh is a conservative estimate. And as the dementia progresses, the cost is going to increase. So that is also something that we need to account for. We can't say this is the cost. In the milder stages, cost will be less. In the moderate stages, cost will be more. In the palliative care stages, the cost will be even more. So we need to understand it's an escalating cost.
And what you're telling us is just the financial cost, the emotional toll that it takes on the person living with dementia, on the persons around that person, the caregivers to that person is also huge. So again, going back to that question that I asked you earlier, uh, what are the biggest problems that you have faced when, as a dementia caregiver?
See, as a care professional or on a personal capacity, both on that way. See, I was a care professional first. Personal caregiving came later, right? So I would say I was better prepared because I knew what I'm getting into, right? So when we talk about care, as a care professional, what do I face? Families don't come to us when the condition is mild. So that's the biggest problem we have. If they would have come when the situation is mild, they do not have to suffer. I'm not even talking about the patient, I'm talking about them. They did not have to suffer so much because when you come in milder stages, you're prepared for what is going to come. There are ways we can keep the person with a better quality of life for much longer. We will tell you what is it that you need to do: one, two, three, four, five, financial, what you need to do, social, what you need to do. How do you ensure that the care is planned at the house level? All of those we could have told you. We could have told you what are the opportunities for help here. Where can you actually send somebody during the daytime so that you don't burn yourself out? Those are things that I wish people would come to us early. That's number one. Number two, caregiver burnout. Don't wait till you burn out completely. It is not required. There is help available. It's about going and asking for that help. For us, we do not, in our families, no, we don't talk about an elderly person having psychiatric issues or a condition like dementia with others. We try to do everything by ourselves. And that's really not the right way to do it. I always give this example, right? So think about a person with dementia as someone, as a glass with a hole, and you are pouring water into it. At one point of time, both the glasses are going to be empty. That's not what we want. So we need to understand how to replenish, how to seek help when you're caring. It says that it takes a village to raise a child. It takes a community to care for somebody with dementia. So I hope that caregivers understand that you don't have to do it alone. You really don't have to do it alone.
You spoke about facilities that are available for daycare or whatever. So, what are the kind of facilities that are really available in India for dementia care? Starting from the early stages to the late stages.
So, see that you need different kinds of facility throughout the journey of caring for somebody with dementia, right? The initial would be, like say we run a helpline service. See, that's an initial service because you may have somebody at home with memory loss. You may not know what actually you need to do about it. Uh, one of the alert I would like to put it is, please don't go to chat gpt or google to ask what you need to do, because it would throw out things that really that elderly person may not have. So the first thing would be to get guidance from reliable sources, because dementia is a complicated diagnosis. A chat gpt or google cannot make that diagnosis. So first and foremost is proper guidance. So proper websites, proper, go to Alzheimer's Society website, go to Alzheimer's Association website, go to websites in India like ours or Nightingale's Medical Trust, or go to one of the websites that I usually advise people is called Dementia Care Notes, that's run by Swapna Kishore. Very, very detailed website on what dementia is. Very, very simple website which guides you on information. So number one is proper guidance when they have earlier confusions, memory loss, and all of that, earlier guidance. Number two, memory clinics. Memory clinics is a place where you can go and get your loved one screened, get your loved one diagnosed, if at all there is a problem that's going on. In a memory clinic, people just don't treat dementia. They will also treat the other treatable causes as well. They will rule out things that could be treated. They will ensure that those things are taken care of. And memory clinics, we run Dementia India Alliance runs it online, offline. As I said, DEM Clinic is available. There are organizations like Nightingale Medical Trust, DEM Cares. There are organizations like those who are running memory clinic. There are hospitals like Manipal, Apollo. All of them run memory clinics. So you could go to either a neurology, psychiatry, or a memory clinic to get a diagnosis. As I said, you can go to a neurologist, psychiatrist, or a geriatrician. They would be very, very happy to help. So that's number two, memory clinics, where you can actually get a diagnosis. Not just get a diagnosis. Memory clinic is a place where they explain the diagnosis and what it means to you and your family. So that's very important. So memory clinic. Number three would be daycare. A daycare is a service wherein you are able to leave your parent in the morning and pick them up back in the evening. A
Like
daycare
children.
just like for children, because daycare is a service that is life saving in many, many ways. Number one, it allows you to keep your parents at your home for much longer without really bearing the brunt of doing the caregiving yourself. Number one. Number two, it allows the person with dementia to get the most important aspect that they are usually denied of: socialization with people who are just like them. It's very important. Otherwise, people with dementia are mostly isolated. People don't talk to them because they have memory issues. But when they go to a daycare, they're all equals. You give them the opportunity to socialize. So that's very important. Daycare service is very important. Unfortunately, daycares are not something that are available across the country. There are very few people who do daycare. So that is something that should be done widely. Government should try to do it more widely, because then people can go to their job. The loss of income can be avoided. And in a daycare scenario, people also get a lot of cognitive activity, they get physical activity, they get social activity. You delay the progression of dementia as well. So next would be daycare. Number third would be training, support to family caregivers. So for example, we provide a lot of family caregiver training. We run weekly support group meetings along with NIMHANS online, which is completely free of cost. We've been doing it for 2 years. We have more than 1,000 family caregivers as part of that support group meeting. So support group is a place wherein people who have undergone dementia, cared for somebody with dementia, they all come together, talk to each other. See, one of the things we need to understand is when we are talking about dementia, people would take an opinion better from somebody who has gone through it than even a care professional, right? Because they have a lived in experience and they would tell you how to take care of those things. And what is the amazing part of a support group meeting is, I might be depressed doing the caregiving job, but if you are a caregiver, you ask me how to do caregiving, I will always give you a positive tip. So that's very, very important. And caregiving support groups are wonderful therapy to caregivers themselves, because you can share anything and everything with a group that understands what you're saying, and they will not judge you. It's a safe place. So support group is another thing. Training is another thing, because training helps you, empowers you, prepares you from avoiding yourself to slipping into depression, important aspects of your life. Usually, caregivers who look after persons with dementia lose their social life completely. They lose their friends, and when the person passes away, they are never able to go back to their older life, because everyone has gone forward, but they are many, many years back. So we try to tell them that you don't have to do it. Have your life is well. That's very, very important. So training prepares you for all that. So training is important. Then there are these memory care facility or residential care facilities, which are a last option, because anyone, whether with dementia or without dementia, would want to die at the comfort of their own home. Nobody wants to be in a living, like assisted living or a dementia care facility. Nobody wants that. We all want to live in our house, right? See, what happens is, in people with dementia, when they go into a residential care, if they live anywhere between 3 to 5 years to 10 years, think about just that one room becoming their life. It's just not right. But they are needed, because what happens is, what if you have a person who's highly agitated, aggressive, there are behavioral issues that you're not able to manage? What if you are perhaps abroad, or you are single parent, or you don't have resources at your side to actually care for somebody, or you feel you are not better positioned to provide that level of care to your loved one? Then residential care providers are lifesavers in those aspects, right? And what need to understand in India is, we really don't need judgment when somebody puts somebody in a residential care facility, because you are not going through what they are going through. And we are in no way able to judge the pain that a family caregiver goes through when they place somebody in a residential care. Nobody wants to do it out of, just like, because I want to be free. No, they don't want to do it. They do it as the best interest for their loved one, number one. And number two, there's so much guilt with which they do it. The sense of abandoning their parent is so deep rooted. People undergo depression. It's very, very difficult decision to make, and we are so easy to judge. We should not, because we are not in their place. So it's very important that you see it with a empathetic point of view, a non-judgmental point of view. So it's very important that you have that. And at the end, counseling is very important. When the person passes away, we always think that when the person passes away, it's all over. It is not. In India, we don't talk about bereavement. We don't talk about grief, letting go of the grief. It is important that you have that service at the end for so many years of letting go of an individual whom you have loved so dearly. So all these services are very, very important. And most of these services are quite available in the southern part of the country, but in the northern part of the country, there are very few.
Is that because the south is aging faster? The south and the west of India are aging faster than the north. I mean, demographically, if you
Yeah, it could be that. And I also think that in South, perhaps education, there are a lot of people, education is better thanks to many more medical institutions. I think if you look at, all those big medical institutions, like, say, for example, NIMHANS is down here, say, in Bangalore, Center for Brain Research. People talk about dementia. It's out in the newspaper, thanks to the IT companies, there is so much awareness about mental health and stuff like that. I think that, those are things. Government is way more proactive is also one thing that I see. And I think there is more urbanization in the south of India rather than the north of India. North of India, there's still a lot of rural population, right? The urbanization is still a little more slower, apart from Delhi and other places. Delhi, of course, again have, organization like IBHAS and all of that provide, some sort of awareness around brain health and stuff like that. So I think that is also one of the reason why perhaps, south is, a lot more prepared when it comes to dementia care. And I think also thanks to many well deserving, well doing NGOs who are doing a lot of groundwork, years of work in spreading awareness about these conditions. So I think that's where south is perhaps better placed.
right. A couple of things that I wanted to ask you very quickly. Now, you did say that you there is help available to help manage a person living with dementia at home as well. Now, a lot of people, and I'm not going to sit in judgment over here, but probably because they cannot afford a professional caregiver, a lot of people would uh, hire a domestic help to take care, a full-time domestic help to manage a person living with dementia. Now, is that an effective way? Is that helpful, or would you say
See,
that
there are two kinds of situation here. There's an ideal situation, and then there is what we can actually do, right?
Mhm.
In an ideal situation, we would have loved everyone to get a caregiver who's very well trained in geriatric care, in dementia care. So we know it comes with a cost. Can
Right.
we afford? Number two, also, whether these caregivers are trained. Currently, many of the home care providers, if you actually take caregivers, they're not even well trained. They're just being taken from a place, trained for 2 3 days, and then sent out into the communities. That also happens. So I would suggest you should do whatever best you can with what you have. So if you're hiring a home help to look after somebody with dementia, see, it's a first win. You identified that there is a need for an extra support person who needs to do exclusively the job of looking after somebody with dementia. So good. That's the first step you have taken. The second step you can take is train that person. The reason for training that person is that, see, in dementia, what also happens is the people with dementia can be mean. They can do things that the other person who's caring may not understand, that they're not doing it on purpose. So there is a possibility of abuse, there's a possibility of resentment, there is a possibility of harm that can happen either to the client with dementia or the person who's caregiving. It can also cause a lot of emotional toll and distress to the caregiver as well. So what we would suggest is, if you're hiring a home help to actually care for somebody with dementia, get trained. That is very important. And they can be trained. We have trained. And we have trained people who have home help on dementia. And they've turned out to be one of the most wonderful caregivers in looking after somebody with dementia. Because at the end of the day, it's about understanding that person. It is about being empathetic towards him. It is about coming from the point of view that that person is not doing what he's doing on purpose. This much, if you are able to understand, you will be able to provide good care with enough, if we are able to build your capacity.
You also spoke about how a lot of this kind of treatment or help or whatever that we're talking about is very expensive. It does come at a cost. Is there an effort at the policy level? And I know that you are involved at the policy level with the government, at the center, the states. Is there an effort to make it more affordable, more accessible?
Absolutely, there is. One thing that we really have to say is that the government has intent to really work towards this. See, health is a state subject, it's not a central government subject, it's a state subject. So if you want to make a change, you need to advocate with the state government. Now when it comes to India, one of the things that we have to give it to the government is also, we have so many problems, so many things are there. So what happens is, elder care or dementia care falls quite low when it comes to the priorities. And the reason why it falls low is also, the point is that, sometimes what happens, you may want to spend on people tomorrow who may actually turn into contributing workforce, if I'm using the term right. That is also something that people may actually think about, but intent is there. Now if you look at, for example, Karnataka government in 2023, we advocated with the Karnataka government along with NIMHANS and Department of Health and Family Welfare. They did announce dementia as a public health priority, and they said we will work on a state dementia action plan which will look at 5 to 6 parameters for dementia care. They spoke about awareness, they spoke about prevention, it speaks about providing care at an affordable cost, it talks about setting up care system for people with dementia, it also talks about research, it also talks about creating a registry for dementia. So at the government level, if you look at Karnataka government, it is doing its bit, right? So there is this Karnataka Brain Health Initiative wherein they are trying to bring in dementia. They are actually doing a lot more for dementia care. We as Dementia India Alliance is helping the government to do awareness. We are doing screening. We are providing support for persons with dementia. We are providing grassroots level training of professionals, whether it is PHC doctors or ASHA workers, Anganwadi workers, because it's about going to them, telling them what it is, providing the right information and support to people. We are also looking at setting up of support system, but support systems is going to be expensive, and we need funds to really set up those support systems. And the government is definitely doing it. Karnataka is very well done it. Kerala is quite ahead. It has a program called Ormatoni, which works on dementia care. With Tamil Nadu government, we recently had a consultative meet. They are announcing dementia as a public health priority, and they're going to work on state dementia action plan with Dementia India Alliance. We have now inroads into Andhra Pradesh. They have agreed to announce dementia as a public health priority and work on it. Pondicherry already has agreed to work on it. So see, when we go to the government, they don't say no. They are willing. If somebody is ready to do the implementation bit, see, they cannot do end-to-end implementation. If people come around and say, you provide us A, B, C, but we will do D, E, F, the government is very much willing. They are very much open. They want people to come with solutions. They know all the problems. They want people to come with solutions. And I would say,
And let's face it, Ramni, we are sitting in a country which has made digital payments so easy, so accessible, and so uh, affordable as well. And I'm sure that we somebody somewhere will come up with a solution to
absolutely.
make
And
care
as I
accessible.
talking to you, as I was talking to you, I think a national dementia policy will soon be a reality in India. I'm very, very hopeful that that will happen. With Niti Aayog working on the brain health blueprint for the country, I really feel that maybe in a couple of years, India will also have a national dementia plan. And see, plans can be made, but it's all about implementation. And for implementation, we all need to come together, and we need to have these corporates helping us, supporting us to really being able to
And,
implement so that
and I guess while all those systems are being built, all the work is being done at an individual level, all of us can also do the basic minimum that we need to do to ensure
absolutely,
that
absolutely,
we don't lose sight of those 14 modifiable factors. We change our lifestyle and try to
true,
prevent dementia as far as
absolutely.
possible. Right. Well, that's a very hopeful note to end this conversation on. And Ramani, thank you again for sharing your time, your expertise, and of course, for all that you're doing to make it a little easier to live with dementia in India. And of course, as a government, Ramani and other people like her build those systems and put in place the care facilities that we need for people living with dementia. Here's what you and I can do. Do not lose sight of those 14 risk factors that we can change to prevent or delay dementia and a host of other deadly diseases. Now, if you don't know what those are, I suggest you tune into part one of this conversation. The link is on your screen. A downloadable PDF of those 14 risk factors are also available on our website. The link to that as well is in the description of this video. And of course, subscribe to the Never Too Late channel so that you don't miss any of these expert conversations that we have on the Longevity Shot. Thank you for watching.